Hi everyone, today I'll be talking to you about neurodiversity. What is it and how can we use it in our clinical practice as psychologists? So, first, I'm a researcher turned psychologist entrepreneur. My name is Joyce and neurodiversity is a concept that views differences in behavior and brain functioning as normal variations in a population rather than disorders. Nowadays, the definition of neurodiversity has widened and encompasses a range of cognitive differences, including but not limited to autism, ADHD, dyslexia, and dyscalculia. The neurodiversity movements rely on a strengths based model instead of a model of deficit or weakness or problem. This neurodiversity movement argues that just because neurodivergent individuals are a minority and display cognitive and behavioral differences from the norm group, this does not imply disease or deficit. The movement shows overlap with movements in support of demographic diversity, such as the women's rights movements in the domain of gender, the Black Lives Movement in the domain of race, and the LGBTQI plus movement in the domain of sexual orientation and gender. One important difference to keep in mind is that neurodiversity refers to the range of natural brain differences across the human population. When we say neurodivergent or neurodivergence, we really refer to a person whose neurotype is less common in one way or another. So, who fall um, within that neurodiversity range towards the ends of the distribution that are less common in the population. So one thing that's good to mention is that neurodivergence encompasses many conditions. For example, ADHD, autism, dyslexia, and dysgraphia, like I mentioned before. So it's really an umbrella term, an umbrella category that moves away from the current deficits heavy focus. So, for example, the DSM, the Diagnostic and Statistical Manual of diagnosable conditions that we currently use, and the ICD are deficits focused. The current guidelines do not provide much guidance on strengths inclusive assessment and therapy. What they instead ask us to do is to look at a kind of a bullet list of deficits or weaknesses that people have. And if they meet sufficient of those bullet point criteria, then we say, look, they meet criteria for this condition. What we want to do is to incorporate neurodiversity and strengths based principles in assessment and therapy. So it can be an affirming, positive, client centered experience. Right? So we want a balanced, limitations, strengths inclusive kind of assessment or therapy approach to support people to grow and to enhance themselves in a direction that's valuable to them. Currently, clients often experience a deficits-based assessment and therapy, and they experience that as confronting, deflating, and lowering their self-esteem. So really what we want to do is moving from that deficits focused approach to a neurodiversity perspective that really takes into account someone's limitations and someone's strengths. Neurodiversity affirming practice can include many different components and many different qualities. Some examples are to focus on differences, not deficits, and validating differences. Approaching people or clients as that they do not need to be fixed, but can benefit from support or coaching, especially in certain areas, and often drawing on their strengths. Focusing on limitations and strengths. Not talking about disorders, but for example, we can talk about conditions or just differences. Using respectful inquiry rather than assuming we know best. Trying to understand different perspectives. Taking client goals and client preferences and client language into account. And seeing interaction as a two-way street, right? So it's not just the psychologist telling the client what to do, but really having that dialogue and that conversation to try and understand each other and then try to support the person that's sitting in front of you. Personal agency, highlighting safety, so making sure that therapy or assessment spaces are safe spaces. Understanding and respecting neurodivergent communication styles. So, for example, someone might be very direct in their communication or very literal in their communication, and being open and understanding of that. And also adjusting our own communication style a bit based on that preference of the client that's sitting in front of us. Understanding and accommodating individual sensory needs, and encouraging neurodivergent rather than neurotypical listening skills. So, examples of this are that we might often expect as neurotypical individuals for people to make eye contact with us as a sign that they're listening and that they're taking in what we're saying. However, for neurodivergent individuals, they might actually find that very distracting and very distressing. So, they often look away or look at something else. And that's their way of focusing on what the person in front of them is saying. So, not making assumptions about what um, listening skills kind of visually look like. Assisting in developing self advocacy and problem solving skills. And finally, I want to talk to you about some neurodivergent strengths. So, when we look at research, but also when we look at clinical practice, often we think about neurodivergence as still as kind of deficits heavy. We're shifting towards a true use of neurodivergence, so kind of having that balanced strengths limitations perspective. But often we still think in terms of autism or ADHD, for example. When we look at ADHD, there are, for example, many limitations that come with a diagnosis of ADHD. That might be inability to sit still, difficulties with focus, difficulties with organizing and planning, etc. However, it's important to look at neurodivergent strengths as well. And when we look at the research, we see that there is emerging research highlighting these strengths that are really observed in neurodivergent individuals. So, some examples of these strengths are high levels of energy or high levels of focus, often referred to as hyper focused, creativity, divergent thinking, and generating multiple solutions to a problem. Higher novelty seeking, which can be very beneficial in certain situations and certain job roles, for example, right? Imagine you're a manager in a acute care setting, right? Like an emergency department. You will be constantly bombarded with new inputs, new situations, and having I guess, a preference for novel situations would probably help you excel in a situation or environment like that. Rapid decision making under pressure, resilience, ability to multitask, big picture thinking, or in some cases, um, detail oriented focus, cool in a crisis, right? So there are really many strengths that are inherent in neurodiversity and neurodivergent individuals specifically. And it's really important that we take these things into consideration when we as psychologists offer assessment or therapy support for neurodivergent individuals.